Good evening, everybody. I'm Kathy Murahashi, and I'm from the Arc of Washington. And tonight, our webinar is Medicaid Matters More Than Healthcare. This is really about updates about what is happening with Medicaid. If you're not familiar with the ARC is an advocacy organization for people with intellectual and developmental disabilities. I am the public policy specialist at the ARC, and I'm so happy to have my colleague here, Sean Latham. Sean, do you want to introduce yourself quickly?
Hello, my name is Sean Latham from Lacey, Washington. I'm the policy coordinator for Self-Advocates in Leadership.
Okay, so we're hearing a lot about Medicaid, right? And we're going to give some updates about Medicaid. But one of the things we often are, people often don't realize that they're actually on Medicaid, because Medicaid in Washington and elsewhere has a lot of other names that we might not be used to, like Apple Health. When you hear people talk about Apple Health is Medicaid. When we hear, and some people may be in different programs within, Apple Health, so they might be on Molina. They might be on the Community Health Plan or AmeriGroup or Coordinated Care or United Healthcare. That's all Medicaid. Sometimes there's other plans that aren't Medicaid, but often they are. And those are the HMOs that our Apple Health has. The other program that is often is also on Medicaid is Healthcare for Workers with Disabilities. That's a Medicaid buy-in program. And that's super important to know. And so all those programs and, all our waiver programs are also. So when you hear the IFS waiver, Individual and Family Services waiver, the Basic Plus waiver, the Core waiver, the Community Protection waiver, all of those are Medicaid. And also Community First Choice. That is also a Medicaid program. Community First Choice is the program that provides personal care. So sometimes we think, oh, I'm not on Medicaid, but sometimes people really are. And it's important for people to understand, that they are on Medicaid. And I think, let's see my next slide.
As we just heard, Medicaid has many names, and it also has many services people with disabilities uses. Yes, a lot of direct medical and dental care comes through Medicaid, but some of the other vital services through Medicaid are personal care services, respite, residential services, community inclusion and employment assistance, and access to other services through all state waivers. At SAIL we have members on each of these services, and without them, their life, like mine, would be drastically affected. Next slide. Nearly all services that people get from our states comes directly from Medicaid. And again, without these services, people's lives would not be as independent as they want, and even more importantly, some people without Medicaid services would need more costly emergency services or end up in costly congregate settings. Therefore, Medicaid needs to be protected. Next slide. In Washington, like other states, traditional Medicaid comes from both the state and the federal government. Our state puts up 50% of the costs, and then the feds will match that. Those with disabilities and those with kids, who both have low incomes, get served through traditional Medicaid. It also includes people on the Health Care for Workers with Disabilities program who have higher incomes. Our state has also taken advantage of the Medicaid expansion that allowed those without kids to become Medicaid eligible under income limits, and allowed people with disabilities to stay on Medicaid if they have higher incomes up to the 138% of federal poverty level. For the Medicaid expansion there is a 90-10 match where the state pays 10% and the feds 90%. And there is an enhanced match of 6% for services that came under the 1115 waiver that came during the recession. Next slide. It is very important for us to understand the landscape of what's happening in Washington, D.C. As you know, President Donald Trump was elected in November, and he had a very aggressive 100-day agenda. There was a lot of interest in cutting the size and role of the federal government, and there was big interest in extending and enhancing the tax cuts from President Trump's first term. Also, there is a razor-thin Republican House majority led by Speaker Mike Johnson, and there is also a Republican Senate with a new Senate Majority Leader John Thune. Due to the Republicans holding the presidency, the Senate and the House, they have proposed a lot of changes, including cuts to Medicaid. Next slide. The way Congress passes bills are very similar to how Washington state works. The president offers ideas on the budget based off of what the cabinet think and also the president proposals. Then each chamber, the Senate and the House, comes up with a House resolution which decides the size of the budget. After that, the chambers committees develops budget targets for their committee focusing on the services and programs that committee has to look after. For example, the Labor, Health and Human Services, Education, and Related Agencies Subcommittee under the Appropriations Committee looks at health and human service items. Once this is done, both the Senate comes out with a reconciliation bill that is a budget bill that the chamber can vote on and pass. Then once the House and Senate both pass budgets just like Washington state, they must come together and work on a final budget that can pass both sides. This typically takes a long time to do because there are a lot of interests working on this. Once the final budget is agreed on, it will then move to the president's desk, where the president can sign or veto the bill. It's a long and drawn-out process that gets very political. Next slide. This year the budget proposals have been changing a lot, but as it states, there are proposals to cut at least $880 billion in core services and $715 billion in healthcare services through Medicaid, and I will pass it back to Kathy to explain.
Yes. So Medicaid is actually sits in the Commerce Committee, and they were directed to cut $880 billion and over 10 years. And that is almost all of Medicaid. It's a lot. The only other, if they cut all the other services, and that would have been SNAP and a few other things, it wouldn't have been enough to reach $880 billion. So that plan that was produced is about 715 billion in that will hit Medicaid and healthcare directly. To put it in perspective, these are historic cuts. We've never seen cuts this big to Medicaid, not even back in the recession. It's more than when we faced the recession back in 2009 and 2010. So that's just kind of the perspective to keep in mind. Let me go to the next slide. Here's kind of a look what the estimates, whoops, I missed a slide. The estimates for potential the cuts, when they looked at that amount from the energy commerce, this is where it comes from. So it comes from changes to eligibility for Medicaid, and redeterminations by making those happen more frequently. It changes what we call the provider taxes. That's a tax some hospitals and others pay. It's kind of a weird thing where they pay a tax to the state and the state gets to count that as toward their match. And they're making that much narrower, and that is a big savings. And it also is a more difficult way for them to raise money. Again, there's the eligibility rule, changing the eligibility. And then the biggest way they plan to make cuts is through work requirements. And there's also a little bit through something around prescription drugs, and I don't know what that particular cut is, but that just kind of gives you an idea. And this is just, you see these numbers, this is just for 1 year. So that has to be divided out into the states. Yeah. It's very bad. Yes, Ben, it's very concerning. So what does that mean? That means about 14 million people will lose their health care through either administrative barriers in Medicaid, or they're also planning to take away some of the premium support that was happened a number of years ago. They want to pull that back. So people that are on the exchange and are getting support to buy their insurance would lose that as well. So they estimated about 14 billion in cuts, or 14 million people will lose health insurance. The biggest thing they're talking about is work requirements. And this is probably where the biggest cut comes. So what they want to do is create additional steps to eligibility. They must prove that they can't work due to illness or disability, or going to school, or providing care to a child or person with disabilities. And that's onerous sometimes. We don't know what that would look like, how you would prove that. And sometimes when you need your health care and you have a disability, you have to wait a lot, right? Something can happen. Sometimes people become disabled quickly, but if you're waiting for your SSI disability determination, you might be waiting a long time. So when we want to say that Medicaid needs to be there when you need it. And their goal is to reduce eligibility and spending by creating these barriers. Some of the things they're talking about. So here's what the work requirements do. It, again, shuts the front door. You have to prove you have been working to apply. So if you're not working, you can't get Medicaid. And you have to be working, up to 80 hours a month. Now you think about folks, some people, Medicaid is the reason they can work. because Medicaid may give them the medication they need to be stable. They may provide medical equipment or other things so they can work. So by shutting that front door, it may actually keep people from being able to work. Um, Again, you have to work, up to volunteer about 80 hours a month. It requires more frequent eligibility verification, minimum every 6 months. States can make it more frequent than that. So you know how we all have to do that paperwork stuff? Means you're going to have to do it more often. I think our state currently it's 1 year, but this would make it at least, I'm sure our state will try to keep it as far apart as part, but it's minimum 6 months. And it penalizes you for working. So people who already are working and, which they want to promote, they're going to have more barriers too. Right now, it's once a year. Now they're going to have to figure out how they're going to submit that they're continuing to work. And in a sense, it punishes people for working. And it also penalizes them when they lose their job. The original bill said that they had, that came out on Monday, said they had until 2029 to implement. What we're hearing now is we don't have, they're still negotiating, and we're hearing maybe 2027. More sooner than later is what we're hearing, is what they're trying to deal with. Yeah. And okay. So among those enrolled in Medicaid, 6 in 10 are women and 7 in 10 are men. And this kind of shows you, you know, so the narrative that's being played out that we're hearing is, well, they want to help people to work, and they're characterizing, that able-bodied people should be working. And there's just a whole bunch of, sounds terrible, but young, able-bodied people just sitting around playing video games and drawing down Medicaid. Well, the reality is not even close to that. So this tells you, the most people is actually women, and they're mostly older women who are close to retirement age. And that they have a whole lot of reasons. They're working part-time. So 54% of men and 36% of women on Medicaid are already working full-time. Another 24% of women are working part-time, and men 15%. So, and the rest are providing childcare. They have an illness or a disability. They're in school. Or some of them may actually be retired, and can't, or if I can't find work. So it's actually a really small percent of people that are not working. So here we go. That's kind of who are the able-bodied people non-working. So about 4 in 5 are women. There's median household income about $44,000 a year, with an average household size of 4.4. So that's, with children. 1 in 4 live in rural communities. And 1 in 4 are aged 50 or more. A good percentage have a high school diploma or less. And, almost 80% have worked within the past 5 years. So these are not people that don't want to work. It's just that they have faced a lot of different kinds of things. This data right here on this sheet is federal data, not US. Yes, and I'm happy to share the slide deck when we're done. We'll probably post it with the recording when tomorrow sometime. So yes.
I'm on Bluetooth.
And
This is an hour long.
let's see. So the impacts, let's see. Oh, I'm just going to make sure. Is this my slides, Sean? I think this might be Sean's. Just a sec.
I'm not in your advice.
This one's mine. Okay. I'm sorry. I just wanted to make sure that I wasn't taking your space. So the impacts of people with disabilities, about 2/3 of individuals with disabilities come through the expansion. So, we think of traditionally people with disabilities, oh, they go through the route, they have a disability, they go through SSI or SSDI, and they go through that door. And a lot of our folks do. But about 2/3 people with disabilities actually go through the expansion door. Part of that may be because they're waiting for their disability determination. They might have a recent diagnosis. They may be working and make just a little bit too much to qualify for SSI. And again, waiting for an SSI determination. So, there's a lot of people who have a disability that are in that. And what we're concerned is about having to prove that, right? That's going to be difficult for some people. Again, these are barriers that they want to make their budget cuts. Okay. The other thing that this bill does is higher out-of-pocket expenses for those above the federal poverty level, which is very low. So if you make more than that and you came through the expansion door, the bill allows state to charge as much as $35 for each healthcare provider visit and up to 5% of the household income, I think, which could total as much as $1,000 a year they could have to pay, especially if they had a lot of different appointments and such. So that's concerning. The 138% of poverty is very, very low. It's, not very much money at all. The other thing it does that's concerning is right now, when you apply for Medicaid, it will allow you to be retroactive for 90 days. So it'll go back and say, do you have medical expenses when you fill out that form? Do you have medical expenses in the last unpaid medical expenses in the last 90 days? And that is really helpful for a lot of people. I can tell you, I have a son that had a brain injury who, was in the hospital, and being able to do that was amazing because he had very high expenses. He could get on Medicaid right away and go back to the date of his injury. So, and they're going to shrink that from 90 days to 30 days. And okay. Let's see. Is this one mine, Sean?
Yeah,
Okay. I think it is. Okay. I'm just making sure.
I got the 522.
Okay. You've got a ways. Okay. So other cuts, what this does is it lowers the federal match for the expansion from 90 to 80%. Not all states are going to have that, but Washington is one of the states that are identified that will do that because we choose with state-only money to provide care to some individuals, not all individuals who are undocumented. And they are that by doing that, they're going to reduce by 10% the federal match. That's a lot of money. It also blocks state flexibility by limiting how states can raise funds to maintain Medicaid programs. That has to do with those provider rate issues. They limit how much you can do that, and put a cap on that. This is also concerning. It took away some rules that eliminates requirements that nursing homes have adequate staffing to ensure residents get seen once every 24 hours. That's not a very high standard. Thankfully, Washington State already has a law that says that that the staffing ratio has to be better than that. But they're eliminating that rule. So that impacts other states as well. So what is the impact on Washington? So Washington would lose about between 15 and 32% of their Medicaid enrollment. That's estimated to be about 138,000 people. With the reduction of federal matching from 90 to 80%, that equals about $1 billion. So that's a real concern. So by creating new administrative barriers, that means the state will need to create new infrastructure. They're going to have more staff to be able to, if you have to do that twice a year rather than once a year, they're going to need the staff to be able to double that. They'll have to double that. And all that administrative stuff is going to take, require employees to provide. Rural hospitals are going to be hit particularly hard because in those areas, there's a higher rate of people on Medicaid. So what will happen is we'll see people ending up in the emergency room. And that's much more costly to be able to provide care through the emergency room than it is for them to have a regular doctor's appointment. And, what happens when the costs go up to the hospitals and other ways, it means all of us who have private health insurance are going to pay more. That was one of the things is that it saved money. The ACA and expanding Medicaid saved the hospitals and others money over the course of time. Even though our health care has gone up a lot, it's not gone up at the rate that it would have without it. And sadly, people will become, because they can't get the care they need, will become more sick and disabled and ultimately could die because they aren't getting the care they need. But wait, there's more. Now, this webinar is about Medicaid, but I want to talk just a little bit about SNAP because of how it impacts our state. So SNAP is, we used to call that food stamps, but, a lot of our people with disabilities are on food stamps. And, but the thing is there's the cuts, it also comes from the same pot of money out of Commerce, that same committee that Medicaid comes out of. And so it has deep cuts as well. And so this is new. It would require, so SNAP has always been an 100% federal program, right? The federal government paid for all of it. And now it would require states to pay at least 5% of SNAP benefits. The first round that said by 2028. Then they were also going to create another barrier, call it responsible for errors. So most errors they find within the SNAP system have to do with like, oh, I didn't get my paper back in time and they just reinstate it. And there's other it's administrative rather than any kind of fraud or abuse. But depending on the state's error rate, they would owe between 6% or as high as up to, if their error rate was between 6 and 8%, they would owe 15%. They'd have to pay 15% rather than 5% of the match. It's 8 to 10%, it would be 20%, and 10% or more, it would be 25%. So this is pushing it down to the states. And this was what it shows in how many millions in Washington state each level would bring. every state has an error rate of at least 6%, except for, I think, South Dakota. It also has work requirements for individuals of children over the age of 7. Currently, it's for children up to the age of 18. And there are no waivers when there's lack of work, like if there's a recession and the unemployment rate is high. It also prevents future administrations from increasing SNAP benefits during emergencies like COVID or other kinds of emergencies that may occur, that they would not be able to. During COVID, they increased the benefit, during that period of time. And now that they would not do that. So other cuts, let's see, did I do this? I think I did this one. Yeah, I went the wrong way. We did that one. And we did that one. So bottom line, the cuts to SNAP cuts about 300 billion. So add that on to all the cuts in Medicaid from the federal budget. About 3 to 3.5 million people would lose benefits in the US. About 79,000 people would lose benefits, SNAP benefits in Washington. About another 100, almost 150 would lose part of their benefits. Their benefits would be lower. Okay, so what does that all mean for Washington? What the federal government, these cuts are doing are pushing the cost down to the states. And they're not giving the states any more money to do it. So it's a lot of things. They've got to figure out infrastructure, all the cuts to the SNAP, and so it's Medicaid, and there's just a lot of things, and that's going to push the states to figure it out. So we'll talk in a minute about how that might look for our folks. And just one of the other things that I thought this was kind of an interesting slide, how the reductions in Medicaid or SNAP affect our state economies. So when we lose people on Medicaid or people lose their SNAP benefits, it actually impacts our economy. Our state Medicaid program, we lose healthcare providers, and those people lose the healthcare providers lose their jobs. And that means they don't have money, and so they don't purchase as much housing or food. So the state local revenue goes down. Same with SNAP. SNAP is always a boon to the economy because they get that benefit and they go out and spend it on groceries. And when they don't have that money to spend, grocery stores revenue goes down, right? And other businesses are hurt, and their income to staff and business. And again, the state and local revenue goes down. So that whole piece about these are important programs for our economy. Okay, Sean.
This is Sean. Now let's talk about some other impacts to those with disabilities and their families. First, because of the healthcare cuts, some direct support professionals, many of whom work part-time or unpredictable hours, could lose healthcare coverage, which would further put a strain on a fragile workforce. As you know, with the aging of America, we already have a provider shortages in many areas, and if we have more cuts, we could see real harm to the workforce and those they are caring for. Next slide. If we do see these cuts, what are some of the options our state might need to consider? We might see narrowing eligibility at the Developmental Disability Administration and at other administrations. We may see more wait lists, for people receiving home and community-based services waivers. We may see more premiums or higher premiums for care, and we might see the need for co-payments. We might see more optional Medicaid services cut. We might see lower reimbursement levels to providers, which are already too low for some to stay in business. And unfortunately, we may see changes to future assessments that could lower service hours. Next slide.
So, what's on?
Medicaid services are divided up into two sections, those that are mandatory, meaning our government must provide, and those that are optional services that they can do but don't have to. The mandatory services are the following: inpatient and outpatient hospital services, physician, midwife and nurse practitioner services, early periodic screening, diagnosis and treatment for children to age 21, lab and X-ray services, family planning, nursing facilities for individuals over age 21, home health services, and non-emergency transportation to medical care. Next slide. The optional services are prescription drugs, dental care, optometry or eye services, payment for durable medical equipment, for example wheelchairs, personal care services, occupational therapy, physical therapy, and speech-language pathology therapy. Intermediate care facilities for those with developmentally disabilities, and home and community-based services waivers. You may have noticed the bulk of services that are optional are those provided in the community, and while other services such as Medicare may be used to pay for some of these services, it doesn't pay for all of these, and it won't pay for many people. Thoughts why all these services are critical. Next slide. Unfortunately, these are not the only changes that might affect people with disabilities and their families. Other things are: 1. The proposal to shut down the Department of Education and move some critical services to other departments. 2. Proposed cuts to Section 8 housing. 3. A proposed plan to close down the Administration for Community Living and other disability infrastructure. This may mean transferring programs and services to other departments or just ending them. The Administration for Community Living holds a lot of key organizations like the Developmental Disabilities Council, the University Center for Excellence in Developmental Disabilities, the Protection and Advocacy System in our state, that is Disability Rights Washington, Centers for Independent Living, Aging, and Disability Services, to name a few. 4. Threats to change Social Security.
A little lost.
Next slide. What's next? As you might have heard today, the House is hearing the budget bill today. I'm not sure if they have or will vote tonight, but their goal is to move the bill before Memorial Day. If this happens, it will then move on to the Senate with a goal to pass there by the 4th of July. I will send it back to Kathy for more.
Thanks, Sean. That's a lot. But, I want to give you a little bit of encouragement. So remember back where we said the first 100 days, they wanted to pass this budget, all this stuff within the first few weeks of this term. And because advocates have been active and calling their legislators and their congressional delegation, we're past 100 days and it's not through. So know that your advocacy is working. They're still, like I said, they're on the floor at this very moment debating this bill. So keep calling and keep talking to them because it does matter. And sometimes people say, well, I've called once or twice. Keep calling. They keep track of who calls. They keep track of how many calls. And that pressure is really important. So yes, and Laura talked about National Adapt. So that's an national organization. And I don't know if you may have seen on the news, a whole bunch of folks from Adapt, mostly in wheelchairs, shut down one of the committee hearings last week and were protesting in the Capitol. And I have to hand it to them. They are amazing. So I think that's an amazing thing. So things that you can do, keep connected, keep learning. The Arc of the United States has action alerts. I'm going to put some other links in here in just a second. We're still collecting stories of people telling their stories that we're using. And you can send that people can send to their congressional delegations. That's really important that people hear. Again, people don't know who are on Medicaid. Most folks don't know about people with disabilities. Our friends and neighbors in the community often do not know about how people with disabilities get services. They kind of think it must be something magical, right? And that everybody gets it. We hear that all the time, but it's just not true. That it's so important to educate your friends and neighbors. So telling your story is one way. I'm going to pop this into the chat box. We have a link where you can go and send your story. You can also, attend town halls. They're happening, when your Congress folks are in town. There may be town halls. They're not in town this week, but they're going to go home probably for the Memorial Day weekend. So maybe next week is going to be a good time. So show up at those. That's a great place. Sign up for action alerts. So the Arc of Washington and the Arc of US, I'm putting those in there in the chat box, how you can sign up. Sign up for our action alerts. We'll let you know what's happening and keep you informed. Make your phone call, send an email, however works for you. The other thing is, if you follow the Arc of King Washington or Arc of King County or some other organizations, there's some great social media posts about Medicaid, informational. Some of them we've used tonight. You can share those on your social media. Again, it's a way to educate the community. And I think that's super important. So, okay, let's see. I'm going to move this along. So here is, gotta go one more. There it is. So there's the number. You can just write that down, and that's the number you can call to get connected. It's a Medicaid Matters line and they'll connect you with your congressional delegation. So write the phone number down, put it by your phone, put it in your cell phone, and you can call frequently. They don't in our state, if you're from Eastern Washington, there's two Republican congressmen that probably could hear from you. But if you're on, the rest of the state is, has legislators that are pretty supportive of Medicaid and such, they still need to hear from you. Because again, they look at that and say, hey, look at how many calls they've received. And they can say, we've received this many calls and we're getting a lot of pressure from our constituents about what is happening. So they are actually asking us, please keep calling or writing. It's really important. Let's see. Oops. So what does Congress need to know? Medicaid is the gold standard of health insurance for kids with disabilities. For our kids with disabilities, it's super important. That keeps families afloat. Home and community-based services and the waivers, they are Medicaid. That's us. And, people with IDD receive services from many agencies. So SNAP's going to impact them. Medicaid's going to impact them. Section 8 is going to impact them. If they're children, the Department of Education impacts them. And it's kind of like death by 1,000 cuts, right? That when we don't just get one cut, we're getting cut across the board for a whole bunch of different things. The other thing that's a message is important is Medicaid actually helps people work. People without disabilities and people with disabilities. It allows them to have the supports they need to be able to work. And frankly, Medicaid needs more money, not less. We already don't have enough money for Medicaid, and it's just going to be disastrous if if those kind of cuts come down. So some messaging, people with disabilities rely on Medicaid to live their lives. Don't cut Medicaid. And, we keep hearing about they're going to take care of all the waste, fraud, and abuse. People with disabilities are not waste. They are an important part of our community, and that needs to be very clear. And cuts cause crisis. We know that when you make these kind of cuts, people go into crisis, and it's not good. It's just not good. Okay, we're getting to the end here. So, what do you need to know? Keep your advocacy boots on. It's not over yet. We're hoping to draw this thing out as long as possible. They did not give a lot of time for people to really examine the bill. They just said, we're going to put it out and then we're going to vote on it. This is what's happening. So, the longer we can draw it out, the longer we can continue to examine the bill, the more pressure we can put. There's some positive things happening on, I think, the Senate side, where the House bill is really horrific. The Senate bill has a lot of cuts, but it's nothing like the House bill. And they've got to come to agreement somewhere along the line. So even if the House bill passes before this weekend, and it very well may, they've got a lot of work to do. And the more that we can educate them and the more time we can stretch that thing out, and, the better we are. We're hearing from some, there's much more resistance in the Senate side to saying, hey, we think this must be too big of a cut, that we shouldn't do this to Medicaid. And they're talking about protecting. There was an editorial by the senator from Missouri about in the New York Times this week about we can't cut Medicaid this much, and this isn't the way to do it. So those are hopeful things. Because of that razor thin margin, it doesn't take a lot of people. On the House side, they only need 3 people, I think it is, to turn and say no. So it just takes a few. So if you're on the Eastern Washington and you are talking to some of those, able to get in messages to those couple of folks in the House, I think that's a really good thing. If you have friends and neighbors in other states where you have somebody in a district that might be willing, that's kind of, leaning one way or another, you can see if you can get your relatives to make a phone call. Again, friends and neighbors in your community, right? Yeah. Medicaid helps make health better. Preventative measures as well. As if the administration is making cuts, how will they get workers who are disabled healthy enough, who want to work and feel productive, just to do that? They're hypocritical. Yeah. It's really hard. It's really, you have to have the care to be able to work. You need the supports to be able to do that. So it's challenging. So I think that was the last slide. So here is Sean and I's contact information. If you have questions, please send us a note. We're happy to chat with you. And I'll stop sharing and see if there's any questions or comments or strategies that you may have used in this time.
Kathy, I was wondering, would it be okay to post my event for Friday?
Absolutely. You put it in the chat box.
Okay, great.
And tell people what it is.
Okay, terrific. I'm planning it's already planned an event Friday 4 o'clock to 5:15 Pacific time. A panel with 3 national speakers and Samantha Fogg from here in Washington State. A panel to address obviously things, what's happening with the Medicaid cuts. Tonight was really an excellent overview, and Friday will be as well an overview, but possibly some more information from the national perspective.
Yeah.
But we're all in the same boat. I really appreciated being here tonight and learning from the ARC, which I completely respect. Y'all do unbelievable work. I'm on your mailing list, Sean, and I know Sean from CDAN. So just very happy to be working alongside, and I'll put the flyer in the chat. You're welcome to participate.
Thank you, Laura.
You're welcome.
Other questions? Yeah, none of it makes sense. You're absolutely right. It's difficult. There we go. Is there a link to the can you put the link to the registration maybe, Laura, or the Zoom?
Yes,
well?
I'm getting that right now.
Thank you.
Sure.
Thank you. Other questions? One of the things I heard just today, and I haven't gone back to look, is that apparently there are some cuts to Medicare as well that are embedded in there. A lot of it has to do with people who are dual Medicare and Medicaid, and that's concerning as well.
Yeah.
Yeah, a lot of our folks are dual Medicare, Medicaid. Okay. Well, thank you for joining us. Sean, do you have any last words?
Thanksgiving. No advocate and Delaware, federal representative, and senators about your story about the impact.
Yeah. Thank you, Sean. Well, wishing you all a lovely evening. Go and do good things. Good trouble.
Excuse me, this is Vicky.
Hi, Vicky.
I was wondering if we're going to meet again.
So we've talked about maybe having another webinar, maybe closer to July. We haven't set a date or time yet for that though.
Okay, thank you. Sean will let me know.
Thank you. Take care.
Okay. Okay.